Hi, my name is Marx, and I'm a research assistant for the University of North Carolina Teach Autism program. I'm a blonde woman wearing a gray sweater. Today I'll be presenting my poster titled Informing a Successful Inclusive Exercise Program, Input from Exercise Professionals, Caregivers, and Adults with Intellectual and Developmental Disabilities for the AIRP Research Day. To start, past research has shown that autistic adults participate in less frequent, strenuous, or moderate physical activity. They have less positive attitudes towards physical activity and report more barriers to participating compared to non-autistic adults. Autism spectrum and intellectual disability, or ID, are often co-occurring in individuals with a prevalence around 30%. Adults with ID also participate in physical activity less than other populations, leading to higher levels of chronic and aging-related disease. We developed the Physical Activity and Community Empowerment, or PACE program, which is an inclusive exercise program aiming to promote physical activity for adults with ID. We gathered stakeholder input from 19 exercise professionals, 54 caregivers, and 15 adults with ID. We conducted surveys and semi-structured interviews to gather information about barriers and facilitators to exercise for adults with ID. An inductive thematic analysis was conducted which revealed consistent themes across all three groups. On this slide, there's a chart divided into 4 sections with the word facilitators in the middle. One of the facilitators we identified was education and training. A caregiver said that caregivers should be educated about the importance of exercise and physical activity for their adult children's health. Understanding the benefits such as improved physical health, mental well-being, and an increased independence can motivate caregivers to prioritize these activities. Environmental attitudes was also identified as a facilitator. One participant said that inclusive exercise environments benefit everyone involved by promoting diversity, breaking down stereotypes, and fostering a sense of unity. By providing these supports, you can create an inclusive and successful exercise community where individuals with and without disabilities can thrive together. Personalization was also identified as a facilitator. One person said that ensuring that exercise options cater to the specific needs of their adult children with disabilities. This guidance will empower caregivers to create welcoming and accommodating fitness environments, promoting physical activity and overall well-being for their loved ones. Community support was also identified as a facilitator. One person said that the availability of social support together with a positive social connectedness and a suitable physical environment are essential to being physically active for people with disability. This slide also has a chart divided into 4 sections with the word barriers in the middle. One barrier to participation was motivation. An adult with ID said, "It gets boring and intrinsic motivation just doesn't really work with me." A caregiver quote about transportation, which was also a barrier, says that more geographically dispersed opportunities so that cost and time to get to Chapel Hill or other centers of such activities is not an obstacle. Of course, public transit would improve all that as well. Lack of resources was also a barrier. An exercise professional said that the global CrossFit competition called the CrossFit Open does have adaptive divisions, which were recently added and are a welcome step to being more inclusive, but this is only a few weeks during the year, outside of which there is limited guidance for how to best adapt training. Finally, inaccessible facilities was also a barrier. One caregiver said that the noise level is a factor for my son. Not too much talking, lots of balls bouncing in a gym, loud music. If there's too much auditory stimulation, my son will cover his ears and want to leave. This is important because clinical trials are not always informed by the voices of those that they impact. Because we had the opportunity to have a pilot study, we were able to collect input before our first cohort so that we can adjust as needed to support inclusion and success of the PACE program. We can also use this information to inform future inclusive exercise programs. As far as how our research translates to impact the community, we're able to provide more accessible opportunities for adults with ID to participate in physical activity. Participants will also experience a sense of community in the program. For adults with ID, that's interacting with other people in the community during the fitness classes. And for exercise professionals, that's building leadership skills and experience in working with diverse populations. As far as successes and challenges for translating our research for the community, some challenges may be that different people experience different barriers or facilitators that we have not yet anticipated. For example, different regions outside of North Carolina, where the majority of our participants live, and rural areas that may have less resources. Our program does not address other factors related to health, like nutrition, chronic conditions, and emotional state. As far as successes, our research gathered information from multiple perspectives, like self-advocates, as well as their caregivers and exercise professionals. Thank you so much for listening, and reach out if you have any questions. Goodbye.